Hello friends, welcome to Ezinurse where nursing education made easy. This is exclusively for the first year GNM nursing students. Here is your exclusive question paper on community health nursing first. So let's check the exclusive question paper or the model question paper that may come for your exam. So first, let's see our introduction part here. So your time. So you have the time of 3 hours to write the exam and your maximum score will be 75. So you'll get 75 marks questions and also 3 hours to complete the particular exam. So let's discuss one by one what are the question pattern it will come. So the first pattern will be give the meaning of following words. So you need to write the meaning of the following words. So here example, cold chain, carrier, epidemiology and immunization. So this is the first part. Now coming to the second category of questions, that is fill in the blanks question. So you have 4 questions to answer, fill in the blanks questions. So deficiency of dash in diets leads to goiter. So that's the first question. Next one, typhoid caused by dash. Next one, the best method of disposal of hospital waste is dash. And the next is deficiency of vitamin causes dash. So these are the questions. So the serial number is here again repeating. So 1, 2, 3, 4, then 5, 6, 7, 8. So the ninth question we will see before that, it's a short note of any 4 of the following. You will get 5 questions. You need to write short notes on the 4 questions. So here, first one, levels of healthcare. The 10th question is revised national immunization schedule. Next is principles of health education. Explain about under 5 clinics and water purification methods. So the next category of questions will be answer the following questions. So you will need to answer the 4 questions will be there. So the 14th question will be classify vitamins and the 15th explain the sources and functions of vitamin D. And the next question define home visiting, discuss the principles and steps involved in home visiting. So the next category of questions will be state whether the following statement is true or false. You will get true or false questions. So particular that you need to write the question number, then you need to write whether the statement is true or false. So the first statement or the 18th question is vasectomy is the method of contraception in males. You need to write either the statement is true or false. So next one is World Health Day is celebrating on April 7. So next question or the 20th question is chikungunya is transmitted by consuming of infected chicken and vitamin K is a fat soluble vitamin. So these are the 4 statements. You need to write either it is true or false. The next category of questions will be write short notes for any 4 of the following. You'll get 4 questions. You'll get to write the short notes. So the first question is methods of waste disposal, steps of counseling. Next one is mode of disease transmission, food hygiene and referral system. So the next category of questions or the last category of questions you need to attend is answer the following questions. So here define balanced diet and write about the classification of food. Then write in detail about the Food Adulteration Act. And then 29th question is define communication. And the last question will be discuss the methods of communication. So this is the pattern of question paper or the questions you will get in your exam. So now let's discuss one by one the answers of this particular questions. So the first category was give the meaning of the following words. So first one is cold chain. So what is cold chain? So cold chain is a system of storage. It's a system of storage and transportation of vaccines at recommended temperature, usually 2 degrees Celsius to 8 degrees Celsius from the manufacture point to the administration point to maintain their potency. So from the manufacture point to the administration point, we are storing and handling the vaccines to maintain their potencies in that temperature. So the particular temperature is 2 degrees to 8 degrees Celsius. That is what known as cold chain. So second word was carrier. So what is carrier? It's a person who harbors and shed a specific infectious agent without showing clinical symptoms and transmitting the disease to others. So he or she is the person who carry the disease without any symptom. They don't have any symptoms, but they'll give from them to other people. They'll give the disease. So that is carrier. So example, mother may be a carrier of a particular disease. The mother won't have any symptoms, but the child may develop that particular disease. So that is carrier. So person who harbors and sheds a specific infectious agent without showing clinical symptoms and can transmit the disease to others. The third question was epidemiology. So what is the epidemiology here? It's a study of distribution, determinants and control of diseases and health related events in specific population. So we are studying about specific population. So what are the things we are studying? About the distribution, determinants and control of disease and health related events. So that is what called epidemiology. So the fourth question was immunization. So what do you mean by immunization? It's a process of protecting an individual against infectious diseases by administering vaccines to stimulate the body's immune response. We are administering vaccines, boost our immune system to fight against the infectious diseases. That process is known as immunization. So these are the first 4 question answer. Now we will discuss about the next category, that was fill in the blanks question. So what is the filling the blanks here? Deficiency of dash in the diet leads to goiter. What it is? Iodine. Deficiency of iodine in diet leads to goiter. So that is the answer. So second question was typhoid is caused by Salmonella typhi. So Salmonella typhi is the causative organism of typhoid. Next is the best method of disposal hospital waste is incineration. So we can do incineration. So that is the best method to disposal of hospital waste. Next one is deficiency of vitamin C causes scurvy. So this is the answer for fill in the blanks questions. Next category is write short note of any 4 of the following. So the first one is levels of healthcare. So what are the main levels of healthcare? Primary, secondary and tertiary level. So what is primary care? It is a first contact care, promotive, preventive and basic curative services we are providing. So here we have promotive, preventive and basic curative services. Example, sub-centers and PHC. So that is the example for a primary care. Next is secondary care or secondary sector, that is secondary care. It's specialized care and referral service. Example, CHSC, district hospital. So it has specialized care and referral services. Next one is tertiary care. It is super specialty and advanced treatment. Example, medical colleges and specialty hospitals. So the next question we are going to discuss is revised national immunization schedule. So it's very important question, revised national immunization schedule. So at birth, BCG, OPV0, hepatitis B, that's a birth dose. Then 6th week of the age, then DPT1, OPV1, hepatitis B1, HIP1, PCV1 and rotavirus 1. So this is the study. You need to detailedly study about the immunization schedule. Next, we are moving to the next question, principles of health education. So what are the main principles of health education? First one, assess need. So identify the health problem and educational requirement. So based on the patient need or based on the family need, we need to give the health education. Learner-centered, to tailor to age, literacy, culture and belief. So the words or the health education we are giving, it should be appropriate for the age of the people. Like a baby, if you are giving a child the health education, then it should be appropriate for their age. Then literacy, culture and belief. Participation. Encourage active involvement and discussion. So discuss the things with the patient and encourage the active participation by the patient. Next, relevance and simplicity. Make content meaningful, clear and practical. So it should be relevant. If you need to teach a patient who is having hypertension, it should be relevant to that particular condition. Then continuity and motivation. Reinforce learning and encourage behavior change. You need to motivate them to change their behavior. Next, use multiple methods. Combine talk, demonstration, media and visuals. You need to use audio-visual aids like a combined version. You can use all the like talks, demonstration, media and visuals. So next is evaluation. Assess the effectiveness and modify the program as needed. So these are the principles of health education. So now let's discuss about the next question. Explain about the under 5 clinic. So what is under 5 clinic? It is the health services for children below 5 years of age for preventive, promotive and basic curative care. So we are promoting the health, preventing the diseases and or giving the treatment or curative care we are giving. That health services for the below 5 years is known as under 5 clinics. So its objective is to promote growth, prevent illness, reduce under 5 mortality. And the services are growth monitoring, immunization, nutrition advice, treatment of minor illness and referral services. So what are the places we can do this, or what are the places under 5 clinics are running? It is PHC, CHC, Anganwadi centers. And the importance are it ensures early detection, healthy growth and parental education. So this is all about under 5 clinics. So the next question, the 13th one is, what is water purification method? So let's discuss about water purification method. So first one is storage. Allows sedimentation and reduces bacteria. So we will keep the water in a storage. So what happens? The waste or the sand present in the water, it will be sedimenting below. So slowly it will be sedimenting. So that's the first one. Next is filtration. Remove suspended impurities like sand filter and candle filter. Next, boiling. It kills disease-causing organisms. So we can do water purification through boiling. So in our usual household or in our kitchen, our home, we are doing the water boiling. Next is chlorination. So it destroys pathogens like bleaching powder, chlorine tablets. So we will add the bleaching powder in water to destroy the pathogens. Next is distillation. Remove salt, microbes and chemicals. The next process is solar disinfection. So sunlight kills microorganisms. So these are the main water purification methods. Now let's move on to the next question. So here answer the following question. So first one, classify vitamins. So that's the 14th question. So what are vitamins? It is mainly classified into fat soluble vitamins and water soluble vitamins. So what are fat soluble vitamins? It is vitamin A, D, E, K is classified as fat soluble vitamins, and water soluble vitamins include vitamin B complex B1, B2, B3, B5, B6, B7, B9 and B12 and vitamin C. So this is the classification, fat soluble vitamins and water soluble vitamins. So now coming to the 15th question, explain the sources and function of vitamin D. So vitamin D, the sources are sunlight. It is synthesized in the skin. So if we need to get vitamin D, we need to get the sunlight. So sunlight is the main source. Dietary sources like fish liver oil, fatty fish, egg yolk, milk and butter, fortified food. So these are the sources of vitamin D. Coming to the function, it promotes calcium and phosphorus absorption inside the body. So it is promoting the absorption of calcium and phosphorus, maintains healthy bones and teeth. So our bones and teeth should be healthy. It's because of this vitamin D. And prevents rickets in children and osteomalacia in adults. And it also supports muscle strength and immunity. So this is the sources and function of vitamin D. Now let's move on to the 16th question. Define home visit. So what is home visit? It's a planned visit by a health worker to an individual or family at their home, providing promotive, preventive, curative and rehabilitative health services. So the health worker will plan and go to a particular individual or family and meet them at their own house. So for what all the things we are doing, it's a preventive, curative and rehabilitative health services. So that is what called home visit. So now let's see the principles and steps involved in home visiting. So what are the principles? It's a planned and purposeful. So we are planning and it's a purpose. So based on the needs of the family, regular and continuous. So follow-up care are ensured. So we'll regularly and continuously we will visit the houses. Good interpersonal relationship will build trust and cooperation and respect for family customs and privacy. Then education oriented, focusing on the health teaching and self-care. So this is the principles of home visiting. Now let's see the steps. It is planning. Identify family, set objectives and prepare the supplies. Preparation, review record and plan the activities. Home visit, provide care, health education and counseling. Then recording and reporting, document the findings and services given, evaluation and follow-up, assess outcomes and plan for the next visit. Next category of questions will be state whether the following statement are true or false. So the next question is 18th one. Vasectomy is the method of contraception in males. So it is a true statement. So vasectomy is the method of contraception in males. So World Health Day is celebrated on April 7. So it is also a true statement. April 7 is celebrated as World Health Day. Next one is chikungunya is transmitted by consuming infected chicken. So it's a false statement. So it is a mosquito. A mosquito will be causing this infection. Next, vitamin K is a fat soluble vitamin. Yes, it is. It is classified as a vitamin. K is classified as a fat soluble vitamin. So this is the answer for the true or false questions. So next category of questions, short notes for any four of the following. So the first one is method of waste disposal. It is open dumping. So what is open dumping? Waste is disposed in open areas without any treatment, causing environmental pollution. So without any treatment, we are throwing the waste into open areas. That is what called open dumping. Next is sanitary landfill. Waste is buried in a controlled manner to prevent contamination of soil and waste of soil and the water. So it is a controlled manner to prevent waste. So sanitary landfill. So incineration, it's a waste is burned at high temperature. So we are using temperature, high temperature, that is 800 to 1200 degrees Celsius of temperature we will use to heat the waste. So waste is burned at a high temperature to reduce volume and destroy the pathogens. Next, composting. Biodegradable waste is decomposed to produce organic manure. Next one is recycling. So we will reusable materials are processed to make new products, reducing the waste. So the waste we will be reusable, we will make it into recycle. Then burial. Waste is placed in pits and covered with soil, mainly used in the rural areas. Then manure pits. It is organic waste is collected in pits and converted into manure for agriculture. So these are the methods of waste disposal. So now let's move on to the next question. Steps of counseling. So what is steps of counseling? First one, establish rapport. So building a trust, build trust and supportive relationship. Next, identify the problem, assess the needs and concerns. We need to identify what exactly the person or individual's problem. Then explore alternative, discuss possible solutions and options. Also, decision making, help client to choose the best option for them. Next, implementation, put the plan into action, follow up and evaluation, review progress and provide support. So this is the steps of counseling process. Next question we are going to discuss is the question number 24, that is mode of disease transmission. So what are the modes here? Direct and indirect. What is direct? Direct contact, droplet infection, transplantal transmission. So that is direct. In indirect transmission, it will be airborne droplets like airborne, droplet nuclei, dust. Vehicle-borne, food, water, milk or blood. Then vector-borne, mechanical and biological vectors. Then common, it is common vehicle, format transmission through contaminated objects like utensils, clothes and toys. So these are the transmission of or mode of disease transmission. So next question is 25th question, food hygiene. So what is food hygiene? It refers to the practice followed in handling, preparation, cooking, storage and serving of food. So at the handling, cooking, storage and serving at the time of food serving. So what are the practices we are following? It is known as food hygiene to prevent. So why we are using it? To prevent the contamination and foodborne diseases. So next question, it is the 26th question. It is the 26th question, referral system. What it is? It's an organized process of transferring patient from one level of healthcare to another for specialized diagnosis, treatment, management to ensure continuity and quality of care. From PHC to the CHC, from CHC to district hospital to specialized hospital. So it is referring the patient. It's an organized process. We are transferring the patient from one level to the another level for better treatment, better diagnosis and better management. So that is what known as referral system. Next we will see answer the following question. So the 27th question will be define balanced diet and write about the classification of food. So what is balanced diet? It's a one which contains all essential nutrients to correct proportion, maintain the health, growth and energy. So it is a balanced diet in which it contains all the type of essential nutrients in a correct proportion to maintain health, growth and energy. That is what known as a healthy diet. So that is also known as a healthy diet. Also it is known as a balanced diet. Now let's discuss about the classification of food. So first one is energy giving foods like cereals, fat, oils and sugar. Next is bodybuilding foods like milk, egg, meat and pulses. Next category is protective foods, fruits and vegetables rich in vitamins and minerals. So this is the classification of food. Now let's discuss about the 28th question. Write in detail about the Food Adulteration Act. What is Food Adulteration Act? It means adding or mixing inferior, harmful or substandard substances in the food. So it is food is mixing with inferior or substandard materials, then it is known as food adulteration. So what are the objectives of Food Adulteration Act? So it is protecting the consumers from unsafe and impure food. Then maintaining the quality and standards of the food. Then preventing fraud and exploitation. So it is the process of adding or mixing inferior, harmful or substances, substandard substance in the food, that is known as food adulteration. Now we'll see the common adulterants. Example, sand in the sugar, water in milk, artificial colors in the food items. So these are the examples for food adulteration. Now let's move on to the punishment. So what are the punishments that will come under Food Adulteration Act? It is fine, imprisonment are both for the offenders. Either fine, imprisonment will be there, or both also will be getting. So next we will see the importance. So it prevents foodborne diseases, ensures food safety and public health. So now we are moving to the next question, that is define communication. So what is communication? It's a process of exchanging information, ideas, thoughts and feelings between two or more people to achieve understanding. So we are expressing our feelings, our thoughts, our knowledge, ideas to two or more people. Then the process is known as communication. So that's the definition of communication. Now let's check the methods of communication. So what are the methods here? Verbal communication. It is oral and written communication using words. We are using words to communicate, oral or written. We are using the words to communicate. Then it is verbal communication. Next one is non-verbal communication. Gestures, facial expression, posture and eye contact are examples of non-verbal communication. Next one is visual communication. Charts, posters, pictures and symbols. Next is formal communication. Official and structured communication. Next is informal communication, casual and unstructured communication. So these are the type or methods of communication. So these are the types or methods of communication. Now let's check the important questions from Community Health Nursing 1. So these are the repeated and important questions. So first is explain primary health care, its principles, elements and role of nurse. Describe the National Immunization Program and role of nurse. Explain home visit principles, steps and its importance. Discuss water purification methods and prevention of waterborne diseases. Describe family planning methods and role of nurse. So these are the important questions. So explain food adulteration and preventive measures. Discuss health education principles and methods. Explain referral system and the levels of healthcare. Describe waste disposal methods and their health importance. Explain nutrition, balanced diet and deficiency diseases. So let's check other important questions. It is under 5 clinic, antenatal clinic, school health services, vitamin A deficiency, vitamin D sources and function, food hygiene, communication and its types, then modes of disease transmission, community health nurse, its role and functions, then environmental sanitation and also define health, define community health nursing, balanced diet, principles of health education, home visit, open dumping, sanitary latrine, immunization, incidence and prevalence, World Health Day, vitamin K, chlorination, referral, vector-borne diseases and food adulterant. So these are the questions. It has came multiple times or repeated questions in your exams. So I hope everyone understood today's section. This is a model question paper. So while you study all the topics and the repeated questions and important questions. So if you have any doubts, you can follow through Ezinurse. So all the best for your exams. Keep learning, keep growing with Ezinurse and thank you.